Hi, Dr. Debunk here. Again, this is video number 5. Oh boy, I gotta pay attention to the numbers. Um, and this is the continuing series on weight and understanding it. And at this point, I was dedicating it to the understanding of thyroid hormone. You'll have to look at the last video. The second half of the last video is all about the start of thyroid. Um, And so, where I was up to was the reality that the way medicine has evolved over the last 110 years regarding thyroid, because we've been treating low thyroid for 113 years. And the original thyroid hormone that we give is the same stuff I give today. It's gotten pricey, but um, I jumped ahead too fast. So let me give you some background. Hormone treatments are natural. Taking extra hormones is not a drug, and it's a natural treatment. You just have to take what we call bioidentical hormones, or the ones that are the same structure that your body makes. There's nothing bad about taking hormones. There's just a lot of misconceptions because you have hormone therapies developing in mainstream medicine in the treatment of disease, but we're not in the gutter of disease. We're talking about making you optimally healthy and having a great metabolism and losing weight. And so that aspect of medicine has been pushed forward by the 5% of doctors that rejected the standard treatment protocols because they don't work, you know, um, and began to listen to patients and believe that, patients you have for many years that are intelligent and logical aren't hypochondriacs making it up. Because here's what happens, and this has happened to a million of you, literally millions of Americans have had this problem with their doctor. They go on the internet and look up their symptoms because they, over a year, start to realize, I am so tired. Why am I tired every afternoon? I feel like I'm 70, not 40 or 35. I get brain fog. I can't exercise. They say I'll have more energy if I go exercise, but then when I do it, it wipes me out and I have to sleep. I feel better in the morning, but then I'm tired again. And if you do your research and dig around for symptom analysis, which they have these programs, you can just look on the internet, every single time it'll say you have low thyroid. If you don't have disease and you have those symptoms, like I've just said, the only diagnosis that fits is thyroid. That's it, really, when you exclude disease. And so you go to your doctor and say, do a blood test, and he says, yeah, I agree with you. He does a blood test and you're normal. And it's always normal, normal, normal. And I've had patients suffering for 15 years that have every single symptom of low thyroid in the book, and the doctor won't treat them. But if you treat that patient, in 2 weeks they want to be your girlfriend because you changed their life. Because without energy, we can't function. We can't think. We don't have the physical abilities. I mean, we talk about hormone deficiencies in levels. There's minimal deficiency, mild, moderate, severe, and extreme. And then above that, you would have normal and high levels of hormones. We're not really dealing with that anymore because very few people naturally make enough hormones. Um, and so you feel one way with minimal deficiencies and another with mild. And you can grade people's symptoms and see how deficient they are. Anyway, um, and so symptom analysis is the only way to know who to treat and not to treat. Now, why doesn't a blood test correlate with the tissue level? That's complicated. It's a lot of medical science. Some of it's still debatable. But the bottom line and the simplest explanation that's accurate, it's an oversimplification, is the blood level of a hormone is a measurement of how much your body made today. Thyroid gland's right here. How much it makes today, it puts all it makes into the tissues, into the blood, and that gets into the tissues. And the blood level reflects that and how much thyroid or any hormone that you store in your blood. We have floating gas tanks. It sounds weird, but we store a lot of hormones, all of them, that are not in the brain, but body hormones are floating around in the blood in floating gas tanks. And the blood level reflects how much stored hormones is on the proteins and how much you made today. It has nothing to do with whether you're deficient or not in your tissues. Well, it's maybe the tissue accounts for 20%. And I can't get into why that is, but the science is overwhelming that that's true. And so what happens is people don't get treated because the doctor says your blood test is normal, you can't be low. But if you have the symptoms that I've talked about, you are low. And the proof is, as soon as you treat somebody, bam, they turn around. People that are very low in thyroid, when you're severely low or even moderately low, in 3 to 5 days you feel different. In 2 weeks, you're amazingly different. And by a month, everybody comes back and it's like they can't believe it. I mean, I had people so angry at their primary care doctors because they've suffered for years, a decade, you know. But doctors now become so technical, and we're like not questioning. Medicine has always been driven forward by questioning what the doctors before did. But I don't even talk to endocrinologists anymore. They're dumb. To me, they're all dumb. They don't care at all what patients say to them. It's whatever the numbers show, and then get out. And it's so disrespectful to people that have a high degree of education, PhDs, masters, and we talk to them like they're idiots. They're making it up. They're hypochondriacs. So the connection, and there's a lot more, but I'll kind of leave it at that. Those are the most important principles. But the thing is, to get thyroid hormone, it's a prescription, you got to see a doctor. But hormones are so powerful, you know, as I mentioned. Testosterone for men and women is the king of motivation, mental motivation, and physical strength, is what testosterone does for both men and women. I mean, men need a lot more testosterone, as women need a lot more estrogen, but hormone therapies are safe. This whole thing about estrogen therapies for women in menopause and cancer is ridiculous. There is no scientific evidence that's accurate or valuable at all to show that there's a connection between the causing of breast cancer and estrogen levels. It's madness in every way. There's probably 40 studies showing no connection and a few crappy ones showing there is. And the way they do the studies is so bad, they don't account for the factors. I'm just so sick of it after 39 years. But, you know, the reason women, as they get older, and men, women start to look like men when they get older, and men start to look like women, is because they're running out of hormones. At some point, 95% of all people need to supplement with hormones. And when it comes to weight, your metabolic rate is so much slower. It's somewhere between 200 to 300 calories slower if you're low in thyroid. But we don't eat less, so you just keep getting fatter. And everybody sees that. They see when their energy levels start to drop, and it usually occurs over 6 months to a year. And for women now, by 35 years old, 50% of women in America need thyroid. And men by 40, 45 catch up. And if you don't have it, you're going to lose weight slow. You're going to see the weight gain over this time period when your energy dropped, and you don't know why. The books and the internet says it's low thyroid, but your doctor says it's not. It is. And that's another reason why with the group weight loss program, I can, if you'll come and see me, I'll take care of your thyroid too, because I only have to see people twice a year for thyroid replacements. Once we dial you in, the way it kind of works is, at first you take thyroid every day for 6 weeks maybe, and then you only need so much every week to not get deficient again, and it's usually 3 or 4 days a week, and there's different types of thyroid. That's a whole thing. But I can do follow-ups over Skype, so I have thyroid patients all over the state, and they'll see me once a year in person, and then I do a follow-up at 6 months, once a year, see how they're doing. And I can do that over the internet with telemedicine. And I'll probably even extend it out to where maybe every 2 years, because blood tests are important for treatment, but not for diagnosing. So I see my time is almost up. And this is a dilemma. The presentation I do on thyroid takes 1 hour, and I'm trying to cram it into 10 minutes. But you will never be at ideal body weight, and you will lose weight slowly if you're low in thyroid. There's no way around that. It's not a drug therapy, it's a natural therapy. It's good for you. There's nothing but goodness about supplementing with hormones. But again, they have to be bioidentical, the same structure. It's not expensive. People spend $10 to $15 a month to take thyroid. My time's up. I'm Dr. Debunk. I'll do a little more